Okay, let's unpack this. You know, that moment you feel a lump in your breast, it can really send a shiver of worry down your spine.
Absolutely. It's totally understandable.
So today, we're doing a deep dive into something that can cause that worry, but is actually quite common and benign, fat necrosis of the breast.
Exactly. We're going through our revision notes, really focusing on giving you the key facts.
Yeah.
What it is, why it happens, what the deal is.
Think of this as your quick guide, yeah. Something clear and memorable.
That's the goal. Make it stick.
Right. So let's start with the definition. What exactly is fat necrosis?
Okay, so simply put, it's the death of fat cells within the breast tissue,
Okay.
and it's benign, non-cancerous.
Okay.
What's really key here, and often causes the initial concern, is that it can happen after some kind of trauma, like surgery or an injury. But sometimes it just happens spontaneously.
Spontaneously? Really?
Yeah, less common, but it happens. And importantly, it can form a lump, a mass, that can feel quite firm, kind of like a carcinoma might,
Yeah.
which understandably causes anxiety. And sometimes that mass might even seem to grow a bit at first.
Okay, so that's a bit tricky then. I like the memory tip. Fat cells falter after trauma.
It helps, yeah.
So what kind of trauma are we generally talking about?
Well, the most common things are previous breast surgery, think lumpectomies, reductions, reconstructions, also biopsies, even significant bruising from an accident.
Gotcha. Direct impact or intervention.
Exactly. But like I said, sometimes you just can't pinpoint a specific cause.
Okay. And who tends to get this? Are there specific risk factors we should know?
Yes, definitely.
Yeah.
A history of breast surgery or trauma is the big one. Also, having larger or more pendulous breasts can slightly increase the risk.
Okay.
And other factors include things like having had radiation therapy to the breast area, or maybe a past history of significant breast inflammation or infection.
So if you had, say, breast reduction surgery years ago and now find a lump, fat necrosis should be pretty high on your list of possibilities.
Precisely.
Yeah.
It should definitely be on the differential diagnosis.
Right. Let's talk pathophysiology. What's actually happening on a cellular level? Why has the trauma caused this?
Well, basically, the trauma disrupts the tiny blood vessels that supply the fatty tissue.
Okay.
When those fat cells lose their blood supply, they don't get enough oxygen, and they die. Necrosis.
Right. Makes sense.
Then the body's natural response kicks in inflammation around the dead cells. And over time, this inflammation can lead to scarring, fibrosis, and that's what forms the palpable lump or hardened area.
Ah, okay. So it's like a deep internal bruise almost, but specifically in the fat.
That's a pretty good analogy, yeah.
Yeah.
A bruise that leads to scar tissue deep inside.
Now, because it can mimic serious things, what else needs to be ruled out? The differential diagnosis.
Super important, this bit. You
Okay.
absolutely need to rule out breast cancer first and foremost.
Always number one.
Always. But other benign things can look similar too, like fibroadenomas, those solid, non-cancerous lumps, or breast abscesses, which are infections, and simple breast cysts, the fluid-filled sacs.
So cancer, fibroadenoma, abscess, cysts.
Those are the main ones. The memory tip, rule out the big four lookalikes, isn't bad here.
Okay, the big four. Got it. How common is fat necrosis, say, here in the UK?
It's considered a relatively common benign breast condition. It's hard to put an exact prevalence figure on it, because it might resolve on its own sometimes or not always be diagnosed specifically. But yeah, it's definitely something clinicians encounter fairly often.
Right, so not rare. And what would someone typically notice? What are the clinical features?
The most common presentation is definitely a firm or even hard lump or mass in the breast. It might be painless, or there could be some pain or tenderness associated with it.
Okay.
Sometimes you might see skin changes over the lump, like dimpling or tethering. Much less commonly, maybe some nipple retraction or even a little discharge, but that's rare.
So mostly the lump itself. How do doctors confirm it is fat necrosis and not one of the big four? What investigations are used?
It starts with a good clinical breast examination, feeling the characteristics of the lump. Then imaging is key, usually mammography or ultrasound or sometimes both.
What do they show?
Well, fat necrosis can have quite a variable appearance on imaging. Sometimes it looks classically benign. Sometimes it has features that can look a bit suspicious, which is why the next step might be needed.
Which is?
A biopsy, either a fine needle aspiration, FNA, or more commonly now, a core needle biopsy. That involves taking a small sample of the tissue to examine under a microscope.
Yeah.
That's really the definitive way to rule out malignancy and confirm fat necrosis.
Examine, image, possibly biopsy. Makes sense. So once it's diagnosed, what's the management? What happens next?
Often, if the diagnosis is clear and the lump isn't causing significant symptoms, or if it seems to be getting smaller, the approach is simply observation and monitoring. Reassurance is key.
Just watch and wait.
Pretty much. However, if the lump is particularly large, painful, or if there's any diagnostic uncertainty even after biopsy, or for cosmetic reasons, then surgical excision removing the lump might be offered.
Okay.
And sometimes the biopsy itself can actually help reduce the size or symptoms.
Right. And the prognosis, what's the long-term outlook?
It's excellent. Really, really good. It's a benign condition through and through. It absolutely does not increase a person's risk of developing breast cancer later on.
That's really important to emphasize.
Crucial. With the right diagnosis and management, the outcome is great.
Are there any potential downsides or complications, though?
Well, the main potential issues are related to the healing process. You can get scarring or fibrosis in the area.
Okay.
This might sometimes lead to cosmetic changes, like a contour irregularity or persistent firmness. And although less common, it is possible for fat necrosis to recur, sometimes even after excision.
Right. Okay. So let's just summarize the key takeaways. Fat necrosis. It's benign, often linked to trauma, can feel like cancer, which is scary, but it isn't cancer, and the prognosis is good.
That's the core message, yeah. Understanding these benign conditions is just so important, both for reducing patient anxiety and making sure the follow-up is appropriate.
Absolutely. Knowledge is power, reduces that fear factor. Well, for anyone wanting to dig deeper or revise this topic further, definitely check out pastthemsra.com.
And also freemsra.com for more resources. Loads of good stuff there.
Great stuff. Thanks for joining us for this deep dive.
My pleasure. Hope that was helpful for everyone listening.